Finally, the personal protection module focuses on the use of personal protective equipment. This relates to the appropriate use of gloves and aprons and other protective equipment for performing specific care tasks.
Personal protective equipment acts as a barrier, shielding both the healthcare worker and the patient from bodily secretions and potentially infectious materials. Before donning your personal protective equipment, wash your hands. If soap and water is unavailable, use a hand sanitizer with an alcohol content of more than 60%. Put the gown on first, next mask, then eyewear, and finally gloves. The gown is to fully cover your torso from neck to knees, arms to wrists. Wrap it around the back and secure it with ties at the neck and waist. If the gown is too small, use two gowns. The first ties in front, the second in the back. There are various kinds of masks, but each is worn in a similar fashion. Place the mask over your nose, mouth, and chin, securing it to your head with ear loops, ties, or with the elastic straps. Follow the manufacturer's directions when securing the straps to ensure a snug, secure fit. Position the flexible nose piece over the bridge of your nose, squeezing to fit. Adjust the mask so it is snug to your face and extends below your chin. Position eyewear over your eyes and secure to your head using the earpieces. If you wear eyeglasses, put them on first, then don your eye protection. If you anticipate splatter or spray, the face shield will provide greater protection for your entire face. Put your gloves on last. Insert your hands into the gloves and extend the gloves to cover the cuffs of your gown. Keep your gloved hands away from your face. Avoid touching or adjusting other personal protective equipment. Remove gloves if they're torn. Perform hand hygiene before putting on new gloves. Limit surfaces and items touched. Remove your personal protective equipment in the following order: gloves, gown, wash your hands, eyewear, mask, and wash your hands one final time. All personal protective equipment must be removed in sequence and discarded carefully. Removal is just as important since equipment is now contaminated. Grasp the outside edge of the glove near the wrist and peel away, turning the glove inside out. Hold it in the opposite gloved hand and peel off from the inside, creating a bag for both gloves. Discard. The gown front and sleeves are dirty, so it must be handled from the back and inside. Unfasten the ties. Peel the gown down and away from the neck and shoulder, turning it inside out. Fold or roll into a bundle and discard. Wash your hands before proceeding. It's important to wash your hands now because they may have become contaminated during the removal of your gown and gloves. The next step is removal of eyewear and mask, and you'll want to be especially sure to have clean hands before proceeding. If soap and water is unavailable, use an alcohol-based hand sanitizer. The outside of the eyepiece is contaminated, so handle eyewear by the earpieces. Pull away from your face and place into a designated receptacle for cleaning. The front of the mask is dirty. For removal, handle only the ear loops, ties, or elastic straps. Remove it from your face in a downward direction and discard. To complete the process, perform hand hygiene one more time. Remember to perform hand hygiene anytime you suspect your hands are contaminated during removal of protective equipment. Let's review the steps for putting on and taking off personal protective equipment. First, wash your hands. Put on your personal protective equipment in the following order: gown, mask, eyewear, and gloves. Remove your personal protective equipment in the following order: gloves, gown, wash your hands, eyewear, mask, and wash your
Bloodborne
hands
pathogens are the most common and dangerous occupational hazards faced by you, the healthcare worker. Infections from pathogens such as hepatitis B, hepatitis C, and the human immunodeficiency virus HIV cause serious and even life-threatening diseases. But the proper use of personal protective equipment, such as gloves, gowns, masks, and eye protection,
Respirators and surgical masks are two types of personal protective equipment, or PPE, that are used to protect workers in healthcare settings. A surgical mask is not a respirator, and that's an important distinction for you and your employer to understand. So let's review the significant differences between a respirator and a surgical mask. What is a respirator? A respirator is a type of personal protective equipment designed to reduce your exposure to airborne contaminants. Respirators are available in different types and sizes, and the respirator you use must be individually selected to fit your face and to provide a tight seal. A proper seal between your face and the respirator forces inhaled air to be pulled through the respirator's filter material and not through gaps between your face and the respirator. If your supervisor requires you to use a respirator, it must be NIOSH certified and must be used in the context of a comprehensive respiratory protection program according to OSHA's Respiratory Protection Standard 29 CFR 1910.134, which includes but is not limited to medical evaluation, fit testing, and training elements. Respirators are used routinely to protect healthcare workers against airborne infectious diseases such as tuberculosis, anthrax, SARS, and hantavirus because they protect against both large and small particles. What is a face mask? A face mask is a loose-fitting, disposable mask that covers your nose and mouth. Surgical masks, dental masks, medical procedure masks, isolation masks, and laser masks are all types of face masks. Face masks help stop large droplets from being spread by the person wearing them, whether that person is a patient or a healthcare worker. Face masks also keep splashes or sprays from reaching the mouth and nose of the person wearing them. However, face masks are not designed or certified to seal tightly against your face or to prevent the inhalation of small airborne contaminants. During inhalation, small airborne contaminants pass through gaps between the face and the face mask and the material of the mask. Remember, face masks are not considered respirators and they do not provide respiratory protection. Only face masks that are cleared by the U.S. Food and Drug Administration, the FDA for short, may be legally marketed in the United States. The FDA approval signifies that they have been tested for their ability to resist splashes of blood and other body fluids. To offer protection, both face masks and respirators need to be worn correctly and consistently throughout the time they are being used. When used properly, face masks and respirators both play an important role in preventing exposures to different types of hazards. If you need the protection of both a face mask and a respirator, you can use a surgical N95 respirator. Surgical N95 respirators offer protection from both airborne and body fluid contaminants and are approved by both NIOSH and the FDA. During an infectious disease outbreak, such as SARS or pandemic flu, face masks and respirators should be used in conjunction with other controls and interventions that are known to prevent the spread of infection. These include engineering and administrative controls, such as installing sneeze guards and permitting teleworking, and work practices such as cough etiquette, hand hygiene, and avoiding large gatherings. For additional information on respiratory protection in the workplace, consult this website. Mention or visual display of the name of any company or product in this video does not constitute endorsement by the Occupational Safety and Health Administration. This video provides a brief overview and general information regarding respirator use in your workplace. It does not cover all of the requirements specified by OSHA's Respiratory Protection Standard at 29 CFR 1910.134 and is not to be used for compliance purposes. Consult the Respiratory Protection Standard for comprehensive information about respirator use in your workplace.